In this image, we've got a capped hock appearance, distension of the calcaneal bursa, indicated by the yellow arrows, and there was also distension of the gastrocnemius bursa as well, which was seen in association with gastrocnemius tendinitis in a horse with a grade 6 out of 8 right hind limb lameness. In this horse, on the top left, we can see that there is displacement of the superficial digital flexor tendon lateral to the point of the hock. The other images were acquired 7 days later, and you can see the amount of soft tissue swelling that has developed with associated distension of both the gastrocnemius and calcaneal bursae. On the right, we can see a post-mortem image of the normal retinacular attachment of the superficial digital flexor tendon to the calcaneus, just so that you can appreciate the thickness of this structure and its potential strength to realize the forces that must be imposed to result in partial or complete rupture of this structure. We believe that in many horses there are predisposing degenerative changes within this retinacular band. This is another horse which had massive distension of the calcaneal bursa that we can see on the medial aspect of the limb. The superficial digital flexor tendon was slightly unstable, and we can see in the caudal image of the hock that it is sitting slightly lateral to the midline. There was a partial tear of the medial retinaculum, which was intact proximally, and the ultrasonographic images show the displaced superficial digital flexor tendon and the very heterogeneous material surrounding it, and the massive distension of the calcaneal bursa. This horse also had bilateral hyperextension of the metatarsophalangeal joints, and I think that this is a significant observation because this was associated with suspensory ligament dysfunction due to degeneration, and we do see luxation of the superficial digital flexor tendon occurring secondarily to hyperextension of the metatarsophalangeal joints as a result of chronic suspensory degenerative dysfunction. This horse was rather different. Although it had a full thickness incomplete tear of the medial calcaneal insertion of the superficial digital flexor tendon, the tendon itself was stable. However, there was firm enlargement of the calcaneal bursa, indicated by the yellow arrows. The horse showed a severe grade 6 out of 8 lameness, which was improved by tibial and fibular nerve blocks. In the ultrasonographic image on the left, the arrowhead highlights the superficial digital flexor tendon, and the small arrow indicates the partially disrupted medial calcaneal insertion. The two longitudinal images, labeled A and B, represent the echogenic material that occupied the medial and lateral recesses of the calcaneal bursa. This horse has a capped hock appearance and distension of the calcaneal bursa, and we can see that there is an old skin injury on the plantar aspect of the calcaneal region. The horse showed a severe grade 5 out of 8 lameness in association with this defect in the osseous outline of the calcaneus.